Today, we're going to be talking about Hirschsprung disease. But first, Children's Mercy Kansas City is here for you. It can be scary and even lonely when your child or your brother or sister is diagnosed with Hirschsprung disease. It's not a very common condition, so you may not have heard of it before or know anyone else who has Hirschsprung disease. You are not alone. We are here, and we are ready to both treat your child's Hirschsprung disease now and help them continue to be healthy in the future. When a child is born with Hirschsprung disease, a portion of their colon doesn't work to eliminate waste. It's missing some nerve cells called ganglion cells that help the colon move waste out of the body. These cells alert your child when they need to poop. These cells help your child's colon eliminate waste when they need to poop. When they are missing, it's hard to get gas and stool out. Waste can build up in the colon, the bowel can't relax, and a child can become very ill. Children with Hirschsprung disease may have difficulty pooping, and toilet training can be a challenge. We don't know what causes Hirschsprung disease. There can be some genetic or hereditary causes, and kids with certain other conditions like Down syndrome are at higher risk. One of the first signs of Hirschsprung disease is being unable to poop within 48 hours after birth. Some babies will have gas, vomiting, swollen tummies, or bloody diarrhea. If your child has a milder case, they might be older when they get diagnosed, usually after having trouble pooping for a long period of time. Your doctor will usually diagnose Hirschsprung disease by taking a biopsy or a small piece of tissue from the rectum and will look at it under a microscope. Hirschsprung disease will be the likely diagnosis if there are no nerve cells. Other possible tests are a contrast enema X-ray that helps doctors see which parts of the colon aren't working right. There's also a special test that uses a balloon to measure pressure changes in the colon and rectum. This is called an Anorectal Manometry and is usually used with older children. Your doctor will help you decide the best treatment plan based on your child's body and level of sickness. Our team of specialists will work together to help your child get better. The main treatment for Hirschsprung disease is pull-through surgery. It removes the part of the colon that isn't working and attaches the healthy part to the anal canal, so poop can pass through. Sometimes doctors will recommend treating Hirschsprung disease symptoms, such as not being able to get poop out, with an at-home process called rectal irrigations. And sometimes doctors will start by rerouting poop from the body to an external bag. This is called a colostomy if the poop is rerouted from the colon, and an ileostomy if it's rerouted from the small intestine. This keeps waste from going to the wrong place and creating infections. Pull-through surgery follows in a few months. Most often, though, pull-through surgery is done soon after diagnosis. One thing to watch out for with Hirschsprung disease is Hirschsprung-associated enterocolitis. This is an inflammation of the colon that can happen before or after surgery, and it can make your child feel very sick. Hirschsprung-associated enterocolitis can be treated with antibiotics and rectal irrigations. Pull-through surgeries usually go very well. Even so, many children still struggle with constipation afterwards. The Comprehensive Colorectal Center offers structured bowel management programs to help children with Hirschsprung disease deal with constipation, toilet training, and other issues post-surgery. We will be with you the whole way, guiding you as you care for your child through this process. Our team stays engaged, whether your child needs regular follow-ups or more intensive treatment. Hirschsprung disease is not common, but neither is our team, and neither is your child. You are not alone. We are here to help your child grow up healthy, strong, and happy. For more information, visit childrensmercy.org/colorectal.